Do you have any sense, is there any sort of working hypothesis of how he could have got this in terms of who he's been or where he's...
Unfortunately, not at this stage. Obviously, we've asked him about he hasn't returned from overseas. He hasn't worked in border or quarantine roles. He has not had any contact with the hospital system. So all of the usual routes where we would expect someone to have acquired the infection are not clear, and that's why this is really requires us to do that genome sequencing to give us that understanding of where that source of infection was, and then we can work back from that. In addition, we will be testing those around him, and so again that may lead us to some other chains of transmission. So we will be following up our usual detective work. The genome sequencing will be a key part of it, but it also will be the cooperation of his family and close contacts in coming forward for testing that will help us identify upstream paths where he could have acquired the infection.
Chant, had the man travelled domestically? The Premier said that there would be genome testing in relation to strains in quarantine, but also in other states.
So this gentleman has not travelled, but obviously we have to keep our mind open about the transmission chains. We know that we've had cases in the community in other states, and also we have the ongoing threat associated with incursions through our borders. So it was just a simple statement that we will look at when the genome sequencing comes back. The question to the specialist will be which strain has this person got and which strain does it match.
How many contacts does he have?
He has a reasonable number of close contacts, and then obviously there will be those venue contacts, which we're going through the process of identifying whether they will be close contact venues. At the moment, they're following up, a 20s of close contacts, but obviously some of these venues may be assessed as close contact venues, and so I don't have in front of me at the moment the capacity of the restaurant or how that's being classified. Obviously, we go through that risk assessment process. We look at where the gentleman was seated and those other factors in terms of understanding close and casual contacts. So the CT values on this case indicate were low. So just to be clear, low CT values mean that you have a higher viral load and therefore potentially more infectious. So they do give us some cause for concern, but also the fact that sometimes the next ring of testing around this case will actually tell us whether he's passed it on. But also in this case, we're really interested in how this person acquired the infection to understand the broader risk in the community. And that's why we're asking people that have symptoms compatible with COVID to redouble your efforts and come out and get tested.